Hi, my name is Lily Holland. I'll be doing my Trach Care video today. Before I get started, I'd be sure to follow my GPSPs and my 2 patient identifiers. So I'm going to go into the patient's room. Hi, my name's Lily. I'll be your nurse. Can you tell me your name and date of birth? All right, and I'm going to be performing Trach Care today on you. Are you in any pain? And they said no, and I'd make sure that they're in the proper positioning, and since they are conscious, they are in semi-failures, and if they were unconscious, they would be in side laying. So the first thing I'm going to do is I'm going to perform hand hygiene and set up my supplies. So I'm going to go ahead and open my Trach Care kits and my inner cannula, and I'm going to get my sterile saline, lip the bottle, and pour into my care kit. So once I've done that, I'm going to put on my PPE and my clean gloves. And I'm going to come over here. I'm going to stabilize the faceplate and remove the inner cannula, noting any abnormalities or any drainage, and dispose. And then I will also get the gauze, also noting any abnormalities or any drainage. Okay, so once I've done that, I'm going to remove my gloves, perform hand hygiene, and put on my sterile gloves. So I'm going to make sure the package is dry, intact, and not expired. Open my package. Put on my sterile gloves. Once I've done that, I'm going to go ahead and grab my inner cannula, stabilize the faceplate, and insert my new cannula, ensuring that it clicks, and it clicked. So then I'm going to come over here, grab a swab, dip it in the sterile saline, and I'm going to clean above. Grab my other swab, dip it, and clean below. Then I'm going to get a piece of gauze, and I'm going to pat dry. So I'll pat dry above. And pat dry below. And I'm going to get my new piece of gauze. Make sure that it's folded, trying to keep the slit of the gauze as sterile as possible. And insert it below, right on the stoma. And once it has touched the stoma, I'm able to manipulate the gauze now, making sure I'm stabilizing the faceplate. I'm going to my saline and see some of that. I want all this thing. Oh, you're getting it. Hello, my name is Kayla. I'm going to be performing assessment today. After doing that, I'm going to go ahead and perform hygiene and put on clean pair of gloves. Alright. Once the gauze is placed, I can now put my new collar on. I'm going to use the one-person method. So I'm going to stabilize the collar. Okay, I'm going to do the same side, or same thing on the other side. Alright, and then once that is secured, I'm going to take off the old collar. Okay. And once that is secure, I will be sure I can put one finger in between, and I can. And then I'm going to take off my gloves, my face mask, and I would dispose of my supplies properly, perform hand hygiene, and document immediately.